Hello everybody, my name is Taylor Boudreau and I'm here to talk to you today about my assigned drug class, which is the ACE inhibitors or the angiotensin converting enzyme inhibitors. There are a number of drugs in this class, but the main ones are going to be your drugs ending in pril. So lisinopril, fosinipral, benazepril, those are going to be the more commonly seen drugs in this class that you'll see in your practice. So the ACE inhibitors produce vasodilation by inhibiting the formation of angiotensin II. The vasoconstrictor, angiotensin II, is brought about by the kidneys. Angiotensin I is converted to angiotensin II by the angiotensin converting enzyme. So the way your ACE inhibitors work is by preventing that converting of the angiotensin I to angiotensin II, which produces vasodilation and helps relax the vessels and cause a drop in blood pressure and reduce the workload on the heart. So it's mainly used to treat hypertension and heart failure. So it is absorbed fairly rapidly and distributed fairly rapidly. It binds to your tissue plasma and proteins and metabolized by the liver and excreted mainly by the kidneys. So actually the only drug in this class that is not highly metabolized by the liver is going to be your lisinopril, so that would be important to note. Some precautions to consider when prescribing this medication is that in smokers, women, and African American members of the community, angioedema has been seen to be more prevalent in this population of people. So that is going to be your swelling of your airway and face, and that can be life-threatening. So you would want to educate on what that is and what it feels like and what to look for, and you would want your patient to report anything like that. Another thing to consider when educating the patients is that frequent use of NSAIDs like Motrin, ibuprofen, Aleve, things like that can actually reduce the effectiveness of the ACE inhibitors, which would not allow blood pressure control. So that would be important to educate. Occasional doses wouldn't hurt anything, but frequent use of NSAIDs causes a decrease in effectiveness of your ACE inhibitors. Another thing would be, because kidneys are your primary organ that help excrete this drug level in your body, people who already have narrowing or stenosis of the arteries that supply the kidneys may be at increased risk for renal impairment or injury. So you would want to make sure you note that when considering prescribing this medication. ACE inhibitors are not safe for pregnancy. It can harm the fetus. So you would want to make sure that if your patient is pregnant or planning to become pregnant, that you discuss with them that they may need another option for blood pressure control, as ACE inhibitors are not safe during pregnancy. Another thing to note is that ACE inhibitors are actually notorious for patients complaining of a dry cough. This is not something that is worthy of discontinuing if the patient can tolerate it, but if it's not something they can tolerate, that they need to let you know so you can look for something else for blood pressure control. Increased potassium levels in the blood or hyperkalemia is another thing to look for, as this can actually lead to arrhythmias as well and cause a number of other problems. So you would want to educate to reduce salt substitutes and high potassium containing foods. And of course, anytime you're prescribing medications to reduce blood pressure, you would want to note that dizziness or feeling lightheaded is something that the patient needs to watch for. And you would want to tell them to change position slowly, monitor their blood pressure for major drops, and monitor their heart rate as well. There's a number of drug interactions with this drug class. Some important ones to note is that ACE inhibitors can actually increase the blood concentrations of lithium, which already has a narrow therapeutic index. So patients who take lithium may need to come in for more close monitoring while on ACE inhibitors. Again, NSAIDs can reduce the effectiveness by increasing the retention of sodium and potassium. So you would want to make sure you teach that. We still want to encourage a healthy, active lifestyle, reduce sodium and potassium in the diet, and make sure we tell patients, again, to avoid excessive use of NSAIDs and to make sure that they tell their doctor if they plan on stopping the drug for any reason, and that they need to talk with the doctor first and not abruptly stop taking the medication. It's a fairly affordable drug, and it's very effective at treating hypertension and heart failure, but there are certainly some things to consider when prescribing this class of drug. So thank you so much for listening, and I hope you have a good day.